And I'm Nurse Alexandra. And we're going to be treating your HIV with antiretroviral therapy.
What is that?
It suppresses the viral replication.
And how effective is it? Is there any side effects?
Yes, there's a lot of side effects, and we'll be discussing those with you as we go through all the medications.
Okay.
Are you pregnant at all, or planning on getting pregnant?
No, I'm not.
Well, when taking this medication, you should not get pregnant because all of them are very toxic to the fetus.
Okay, so I will not get pregnant.
You will be taking zidovudine, efavirenz, and maraviroc.
Okay.
Keep all these medications at room temperature, tightly closed, away from excess heat and moisture.
Okay, so I won't store them in the bathroom.
Yeah.
So the virus uses the enzymes to reproduce itself.
Will it stop it from spreading?
Yes.
This is the first line of the antiretroviral therapy.
So your dose that you're going to be taking for the zidovudine is 200 milligrams every 8 hours.
Okay, so I'll be taking it 3 times a day. I won't get pregnant, and I will not store it in the bathroom.
But can she take it with food?
Yes, because this med can cause nausea, vomiting, and diarrhea.
Okay.
Okay, so I won't take it on an empty stomach then.
It can cause bone marrow suppression also.
So you are at risk for infection, bleeding, and anemia.
Okay. So it makes her immune system weaker.
Yes.
Okay.
So some symptoms you may experience is fever, fatigue, nosebleeds, and an increased heart rate with bone marrow suppression.
So pay very special attention to hand washing, your nutrition, and also stay away from other sick people.
Okay, so I'll be going for blood tests often, and I will always be keeping my hand hygiene in mind.
Yes. You should also get the flu shot.
It is possible it may not be effective due to your compromised immune system, and this medication can also affect your liver.
How so?
It can cause a fatty liver, which we would be monitoring your LFTs.
Are there any other questions?
No, so I'm going to be taking the medication 3 times a day. It could suppress my immune system. I'll be going for blood tests often, and I should store it not in the bathroom and at room temperature in the container that it came in.
Yes.
And from away from heat and excess moisture.
Yes, and you can also take it with food.
Okay.
So, are there any further questions?
No.
Zidovudine, the drug we just went over, it interferes with reverse transcriptase, and the drug we're going to go over now is efavirenz, and this drug inhibits the reverse transcriptase.
That's like the DNA part, right?
Yes.
Okay.
So basically it's helping stop it from spreading?
Yes, both of them do, just in a little bit of a different way.
Okay.
You will be taking 600 milligrams once a day before bed.
Can I take this one with food?
Preferably, no, you don't want to take this one with food, but it can cause nausea and diarrhea.
And what do we do if like the nausea and vomiting becomes so unbearable?
She can crush it in a small amount of applesauce and eat it within 30 minutes of mixing.
Okay.
Okay, so I'll try to take it on an empty stomach, and if I can, I'll crush it in a little bit of applesauce so the med could do its job.
Yes. Other important thing to avoid with this drug is alcohol and hormonal contraceptives. So, like we said before, try not to get pregnant, but it's going to affect your birth control.
And this drug also affects the liver, like zidovudine? That's the first drug? Okay.
And this drug may also cause confusion.
Oh, okay. Like if she's confused, she can't drive at night. I try to keep a clean pathway.
Yes.
Okay.
So you want to try to take this drug at night because you don't want to drive while on it.
Okay, so if I'm feeling confused or drowsy or whatnot, I won't drive to work then.
Yeah.
Just like stay home and like make sure she's in a safe environment.
Yes.
Okay.
So this drug may also cause flu-like symptoms, headache, fatigue, and it may possibly cause you to have a rash.
Can it give me the flu?
Well, no, but you're going to have symptoms of the flu.
Oh,
But it's
okay.
not the actual flu.
And just like, and what if we do if she gets a rash?
This is a possible sign of an allergic reaction, so you would call your doctor.
Okay.
And you would just stop taking the medication as soon as possible.
And then go to
Okay.
the doctor.
Notice it.
So if I'm like red or itchy or anything like that, I'll call the doctor?
Yes, and just stop taking it.
Okay.
Are there any other questions?
No, so I'm gonna be taking it once a day. If the stomach pain and nausea gets too bad, I could crush it in a little bit of applesauce, and I have to avoid alcohol and birth control.
And
Anything
then
else?
Yeah, she's drowsy. I'll just make sure she's in a safe environment.
Yes.
And there's nothing around her. Clear path.
And just don't drive on it
Yeah.
if you're feeling like that. So great. So the last drug you'll be taking is Maravirac.
This will prevent the HIV from binding or entering the human cells.
So it's different than the first two. It works differently.
You will be taking 150 milligrams 2 times a day.
2 times a day, you said?
2 times.
Okay.
Yes.
Can she take this with food?
Yes, she can. This med might also cause confusion and liver toxicity.
Okay, like the other drug.
Yes.
Okay, so don't
Yeah.
drink and be aware if I'm confused.
Yeah, not to drive.
And then with the liver, you're gonna monitor her ALTs. LFTs. Okay.
Yeah.
Got it.
And this drug may also cause you to get an upper respiratory infection and pseudomembranous colitis.
So pseudomembranous colitis, what it is, it's a GI infection caused by C. difficile, and it will cause you to have an infectious diarrhea, which is very contagious. So
Is there any way I can prevent this?
Is like hand hygiene and like make sure everything is clean. Like that's how we can prevent it.
Prevent it from spreading.
Okay.
just like the other drug, hand hygiene and just hygiene in general, nutrition is very important for you. So you want to make sure you're washing your hands constantly.
And would eating yogurt help? Or taking probiotics?
And yes, probiotics will help.
And if anything, we just go back to the doctor and get that checked out as well.
Yes.
Right?
So I would, if you feel like you're having diarrhea or maybe have C. difficile, I would go straight to your physician.
Okay.
Get that checked
Okay.
out.
This med may also cause you to have orthostatic hypotension.
What is
So what that means is that you can't stand up without feeling dizzy.
Mm-hmm.
So your blood pressure will drop quickly.
Is there a way to try and prevent this one as well?
So when you're waking up in the morning, you want to try to dangle your legs and before you get up, so the blood circulates. Because if you get up too fast, then
Okay, so I won't get up too fast so my blood pressure doesn't drop as quickly.
yes.
And you can monitor her blood pressure at home. They just get a machine, monitor her blood pressure at home.
Yes.
Okay.
You could get that from any pharmacy.
And just make sure she gets up slowly every morning. Okay.
Yes.
Or when I'm getting up in general.
Yes.
Yes.
Okay.
Okay.
So, is there any other questions about this drug?
No. So with this med may also make me confused. It can also affect my liver, so I'll still be avoiding the alcohol, and it may cause some.
Oh, dizziness. The orthostatic hypertension.
Mm-hmm.
Yes, I may possibly get C. diff, so I'll be taking my probiotics, and I also might get some upper respiratory tract infections.
Yes. So perfect. You understand this one also, right? One more thing I'd like to let you know is you should avoid ibuprofen and Tylenol because ibuprofen can cause GI effects and
Ibuprofen is like your Advil, right?
Yes.
It'll say it on the bottle.
yes.
Okay.
And then Tylenol is liver toxic. So,
Like some of the other meds that I'm taking.
yeah, so you want to try to avoid these in excess.
Okay.
Okay. Is there anything else you'd like to go over?
I don't think so. So I'm taking Zidovudine, efavirenz, and Maravirac. I'm taking the Zidovudine 3 times a day, the efavirenz once, and the Maravirac twice a day.
Yeah.
Okay.
And the rash was a symptom of the flu.
It's a symptom of an allergic reaction.
Oh, that's when you have to go to the doctor. Okay.
Yeah.
Like the C. diff. Okay.
Yeah, so it's not the actual flu, it's just flu-like symptoms, and the rash is an allergic reaction.
Okay.
And the only one I shouldn't take with food is the efavirenz.
Yes.
And then if I do need to take it with something, just a little bit of applesauce.
Yes.
I guess we'll make sure there's nothing to fall over around the house.
Yeah, you get drowsy.
Yeah, and don't drive if you're feeling drowsy or lethargic.
I'll be going for blood tests often.
And checking your LFTs.
What happens if I stop taking them?
Well, you shouldn't stop because HIV is a lifelong
Disease, yeah.
disease. Yeah.
Really a hard time.
I understand, but if you need to speak with anyone, here's our card,
Thank you so much.
and you can also, if you have any of those side effects, just call your physician. Okay? I wish you the best.
Thank you.